opioid medications can bring substantial relief to patients suffering from pain. However, the inappropriate use, abuse, and diversion of prescription drugs in America, particularly prescription opioids, has increased dramatically in recent years and has been identified as a national public health epidemic. Inappropriate opioid prescribing for pain is defined by the Federation of State Medical Boards as the non-prescribing, inadequate prescribing, excessive prescribing, or continued prescribing despite evidence of ineffectiveness of opioids. Appropriate opioid prescribing is essential to achieve pain control, to minimize patient risk of abuse, addiction, and fatal toxicity, and to minimize societal harms from diversion. Responsible opioid prescribing continuing medical education helps clinicians stay current with evolving guidelines and best practices to ensure their prescribing habits align with these goals. A set of clinical tools, guidelines, and recommendations are now available for prescribers who treat pain patients with opioids. By implementing these tools, clinicians can effectively address issues related to the clinical management of opioid prescribing, opioid risk management, regulations surrounding the prescribing of opioids, and problematic opioid use by patients. Participation in responsible opioid prescribing continuing medical education provides a strong foundation for understanding safe practices and patient-centered pain management. The foundation of appropriate opioid prescribing is thorough patient assessment, treatment planning, and follow-up and monitoring. Essential for proper patient assessment and treatment planning is comprehension of the clinical concepts of opioid abuse and addiction, their behavioral manifestations in patients with pain, and how these potentially problematic behavioral responses to opioids both resemble and differ from physical dependence and pseudo-dependence. Prescriber knowledge deficit has been identified as a key obstacle to appropriate opioid prescribing and, along with gaps in policy, treatment, attitudes, and research, contributes to widespread inadequate treatment of pain. Responsible opioid prescribing continuing medical education addresses these knowledge deficits and equips clinicians with evidence-based approaches to opioid prescribing. Long-term opioid use often begins with treatment of acute pain. When opioids are used for acute pain, clinicians should prescribe the lowest effective dose of immediate-release opioids in a quantity no greater than that needed for the expected duration of severe pain. According to the CDC, non-pharmacologic therapy and non-opioid pharmacologic therapy are the preferred first-line therapies for chronic pain. Several non-pharmacologic approaches are therapeutic complements to pain-relieving medication, lessening the need for higher doses and perhaps minimizing side effects. Information obtained by patient history, physical examination, and interview from family members, a spouse or state prescription drug monitoring program, and from the use of screening and assessment tools can help the clinician to stratify the patient according to level of risk for developing problematic opioid behavioral responses. The Federation of State Medical Boards suggests that before deciding to prescribe an opioid analgesic, clinicians should perform and document a detailed patient assessment that includes pain indications for opioid therapy, nature and intensity of pain, past and current pain treatments and patient response, comorbid conditions, pain impact on physical and psychologic function, social support, housing and employment, home environment, i.e., stressful or supportive, pain, impact on sleep, mood, work, relationships, leisure, and substance use, patient history of physical, emotional, or sexual abuse. When implementing a chronic pain treatment plan that involves the use of opioids, the patient should be frequently reassessed for changes in pain origin, health, and function. There are a number of actions that prescribers and dispensers can take to prevent or intervene in cases of drug diversion. Prevention is the best approach. Communication among providers and pharmacies can help to avoid inappropriate attainment of prescription drugs through doctor shopping. Prescribers should keep complete and up-to-date records for all controlled substance prescribing. By implementing the right tools, clinicians can effectively address issues related to the clinical management of opioid prescribing, opioid risk management, regulations surrounding the prescribing of opioids, and problematic opioid use by patients. In doing so, healthcare professionals are more likely to achieve a balance between the benefits and risks of opioid prescribing, optimize patient attainment of therapeutic goals, and avoid the risk to patient outcome, public health, and viability of their own practice imposed by deficits in knowledge. Responsible opioid prescribing continuing medical education plays a critical role in preparing healthcare professionals to make these informed decisions with confidence and clarity. NetCE has a variety of courses, like developing a safe opioid treatment plan for managing chronic pain, to help you stay current on responsible opioid prescribing continuing medical education. Start learning at netce.com today.